can you lift the breast and do a fat transfer instead of an implant?
Okay, so let's talk about what these things do. Implants make you bigger, lifts make you higher, and then fat makes you a little bigger. And so the question is, can you do a lift and fat grafting instead of an implant to make you higher? Well, you certainly can do a lift and fat grafting instead of an implant. And so now the question is, like, who's a good candidate for a lift and fat transfer? If you are pretty flat or you have no fat, you're not a good candidate for a fat transfer. So if you have no fat, like, where are we going to get it? So super practical, right? If you have a tiny breast, you can think of the breast like a honeycomb matrix, and it has little cells, and in each cell you can put a drop of fat. And so if you have a really tiny breast, you can barely fit any fat in there because anything extra is not going to work. It's just going to go away. If you have a decent sized breast and you can really put a lot of drops in a lot of cells, well, then you can make a meaningful change in the volume of the breast. And so the perfect candidate for the procedure you're talking about, which is a lift with fat grafting, is someone who has a decent sized breast that's just kind of sagged down. And so we'll do a lift and then we'll supplement with a little fat to maybe change the shape, give some upper fullness, and give like a smaller, modest amount of volume gain. So that's really the perfect candidate for a lift with fat, as opposed to someone who's flat where fat's really not a very good option.